Hi there. I'm Lynn Ngai with the Stanford AIM Lab, anesthesiologist in training, here at the 2015 Sol Shnider conference in San Francisco. I'm very privileged to be here with Dr. Lisa Leffert. She is an associate professor of anesthesia at the Massachusetts General Hospital, and she's also the chief of OB anesthesia there as well. Dr. Leffert, it's such a pleasure to meet you.
Delighted to be here.
You gave a great talk earlier about epidurals and uncommon, or not so uncommon, comorbidities that patients may have. Could you give us a few key takeaways from your talk?
I think epidurals are a really important part of obstetric anesthesia. So what I like to think of it is that the patient can have an epidural unless we really have a very good reason not to do it. So really understanding things like what if they have low platelet count, what if they have other bleeding disorders, what if they are missing certain factors, what if they have things wrong with their back. Really understanding what those are and not just assuming that you shouldn't touch them, you shouldn't do an epidural is important. And you find that many of the things are actually okay and you can proceed the way you would in a patient without those things.
You also gave a talk earlier about, a very important one nonetheless, about current updates in OB anesthesia. How would you recommend either OB anesthesiologists or general practitioners of anesthesiology proceed with gathering all the newest information and research when they don't really have the time and when they can't come to this conference and listen to your talk?
So it's a very good question. As part of this lecture, which is originally put together for the SOAP talk, there is a review article that comes out every year, at least one in anesthesia and analgesia, and usually one in the International Journal of Obstetric Anesthesia as well. And that summarizes the year's literature. So that's a good thing to do if you want to reflect back. And the data is still pretty new for most things that we do. There are also in anesthesia and analgesia something called focused reviews, and they again pull together some data, and you don't have to read 3,000 articles, you just kind of read these summaries of things that sort of tell you about some of the common things that you need to know in order to practice obstetric anesthesia.
Thank you so much. It's been a privilege to talk to you.
Privilege to meet you. Thank you.
For the Stanford AIM Lab, I'm Lynn Ngai, signing off.